Hello, my name is Kevin Kleen. I am a board certified sports medicine fellowship trained orthopedic surgeon at Crossing Rivers Health. Hip arthroscopy is actually, it's significantly advanced within the past probably 10 or 15 years that we've been able to perform minimally invasive procedures to the hip. We see labral tears very often in highly active individuals, usually younger active individuals. It can be a traumatic event, or sometimes patients' anatomy kind of predisposes them to have pathology within their hip that can actually cause what we call femoral acetabular impingement. So if you think about the hip joint, it's a ball that sits inside of a cup. So it's a ball and socket joint, and so around that cup there's this nice tissue that kind of acts as a gasket. It's called the labrum. So what it does, it makes a nice negative pressure seal within that joint. Well, if you have someone that has too much coverage of the cup, or they have a big bump on the femoral head and the neck, what can happen is every time that hip comes up, you can actually hit that bump against the labrum, that nice suction seal that we talked about, that gasket, as well as against the side of the cup as well. So if that continues to happen over time, that can cause a lot of pain, and it can also cause damage to the labrum as well as the cartilage itself within the hip joint. So a lot of people that are predisposed to that anatomy, or they have a traumatic event or injury, or they perform an activity that requires kind of those super physiologic movements of the hip. So if you look at a goalie who's kind of in the butterfly position, you have a catcher that's always down in the squatted position, or you have a dancer, that's bringing their foot all the way above their head and doing those movements, that's putting a lot more stress across that hip joint. And we commonly see those types of injuries in those patients. And that's something that we can address now with hip arthroscopy, which is just like the shoulder arthroscopy and knee arthroscopy. We do small little portals, and we can actually put a fiber optic camera or an arthroscope inside the hip joint, and then we can address that labral tear, and then we can also address that kind of the bony impingement of that hitting back and forth to improve the joint itself, and as well as the pain associated with the condition.